although mitochondrial disorders are chronic and largely incurable, today the approach has shifted from basically one of despair and helplessness to a more encouraging focus, not just on diagnosis, but also symptomatic treatment, optimizing energy production through nutritional support, having an early gastrostomy inserted, reducing energy losses, avoidance of toxins, alleviating symptoms, and meeting lifestyle needs such as education, prophylaxis through healthy living and monitoring for complications. Supportive therapies remain the mainstay of management for the vast majority of patients with mitochondrial disease for whom effective curative therapies are lacking. It's important to note that correct and aggressive early management of symptoms will reduce the impact, limit further disability, and optimize the patient and family's quality of life. In 2012, a Cochrane systematic review of treatments concluded that there was no clear evidence supporting the use of any intervention to date at that stage in mitochondrial disorders. So Cochrane review is a rigorous systematic review of primary research in human healthcare and health policy, and they are the internationally recognized as highest standard in evidence-based medicine. Now, so what are the challenges faced in treating mitochondrial disease? Some of the factors contributing to the failure of trials that have been attempted in the past include a lack of natural history data, given the relative rarity and heterogeneity of variability of presentations, the lack of understanding of disease pathomechanisms, a lack of validated biomarkers or screening parameters, and outcome measures that correlate with disease progression, a lack of or inadequate disease models that can be studied, as well as the inaccessibility of the double membrane mitochondria, which makes it very difficult for therapeutic drugs or candidate drugs to reach within the mitochondria, as well as the logistical challenges of conducting clinical trials for ultra-rare disorders. Now, so this cartoon displays a total of, describes a total of 232 ongoing or completed trials which were listed as of April 2019. Almost half of all trials are aimed at testing new diagnostic tools or approaches, behavioral interventions, and such as exercise or the potential side effects of drugs approved by the FDA. So 18% are dedicated to either nutritional interventions or commercially available supplements, some of which many of our patients use, including coenzyme Q, thiamine, riboflavin, vitamin C, and etc. 12% tested the benefits of repurposed drugs. And repurposed drugs are essentially drugs that have been approved by the FDA in an indication that differs to the one for which it was initially marketed. For example, aspirin, which was initially marketed in 1899 as an analgesic. It was subsequently repurposed as an antiplatelet aggregation drug. Surprisingly, less than a quarter of all clinical trials involve new experimental drugs which have been developed specifically for the treatment of mitochondrial disease. This slide, this graphic representation demonstrates the exponential growth in the number of clinical trials registered since 2000, with a total of 232 studies conducted. There is anecdotal evidence that supplements such as the Mito cocktail could be helpful. However, as mentioned previously, 2 Cochrane reviews concluded that there is currently insufficient evidence to substantiate its use in the context of mitochondrial disease. This, however, does not preclude its use, and it is common practice to try supplements in patients and to decide to suspend them if there's no obvious benefit. So this following table lists some of the substances that are often suggested as clinically effective in the literature, for which there are anecdotal reports of potential positive treatment effects. There is no such standard vitamin cocktail. Generally, we use coenzyme Q, riboflavin, vitamin E, vitamin C, alpha-lipoic acid. Creatine is an energy buffer. Folinic acid may be used if there is a central nervous system involvement. Frequently, the patient may not notice much benefit when first commencing this cocktail. However, the difference can often be observed when the vitamin or cofactor is seized. I'd just like to make a note of the treatment for stroke-like episodes in MELAS. So MELAS is a rare disorder that generally presents in childhood, usually between 2 and 15 years of age, and mostly affects the nervous system and muscles. Patients present with seizures, recurrent headaches, vomiting, and stroke-like episodes. The rationale of using L-arginine is that it is a potent vasodilator. It helps prevent or minimize endothelial dysfunction, which occurs in patients with MELAS due to deficiency or reduction in plasma arginine and nitric oxide levels. So the endothelium is the layer of cell that lines the internal surface of blood vessels and heart. And so L-arginine is an important precursor for nitric oxide, which is a vasodilator, and it helps normalize the endothelial function in MELAS. So we use it, the particular use is specifically important if it's initiated within 3 hours of an acute presentation of stroke. We give it as an infusion over 3 to 5 days and put patients on a maintenance therapy. It has been demonstrated to decrease the severity and frequency of acute presentations with stroke-like episodes. Now, so, this next diagram explains the whole process of clinical trials. So these are research studies that test new drugs or already approved drugs or other forms of treatments. And clinical trials are usually conducted in phases that build on one another. The candidate drug is always first tested in vitro, meaning in the lab, perhaps in patient cells, before toxicity and efficacy studies are conducted in appropriate animal models. Clinical trials include phase 1 studies in which the candidate therapy is administered to patients or healthy volunteers to assess the safety and tolerability, as well as the drug pharmacokinetics, which is how the drug affects how the body responds or affects the drug. Phase 2 studies assess the safety and efficacy of drug in a small number of patients, whereas phase 3 trials assess safety and efficacy of drug in a larger number of patients with defined outcome measures. It's important to know the various phases, particularly when there are trials that are upcoming and families might be keen to engage with them. So this figure illustrates the mechanisms of action of emerging therapies, which can be categorized into antioxidants, which act on reducing the ROS generation. Then we have drugs affecting mitochondrial biogenesis by increasing the mitochondrial mass. We have gene therapy, which is a process in which a normal copy of the gene is created by recombinant technology and is administered into the cell where it's transcribed, translated, and then the protein that is produced eventually enters the cytosol by interacting with this particular TOM22 or TIM23 complex. All right, so we'll start by focusing on on antioxidants. So there are a number of antioxidant agents that have been developed with the aim of ameliorating the deleterious effects of ROS, which we have discussed previously. ROS, again, to stress, can impact on the membrane integrity of the mitochondria, can lead to DNA damage, and activation of apoptotic pathways which lead to programmed cell death. So one example is idibinone, which is a synthetic compound similar to the naturally occurring form of coenzyme Q10. It, however, differs from the natural form that it has greater solubility and ability to access the blood-brain barrier, making it more attractive as a treatment option for mitochondrial diseases affecting the central nervous system. It is also able to bypass complex 1 of the 5-enzyme complex, hence making it particularly useful in patients with complex 1 deficiency, for example, Leber's hereditary optic neuropathy, and resulting in restoration of cellular energy generation. So idibinone is the first and only approved treatment in the EU and in Australia for patients with visual impairment with a particular form of mitochondrial disease known as Leber's hereditary optic neuropathy. So this condition occurs due to genetic mistakes or mutations in the mitochondrial DNA. and symptoms are mostly limited to the nerve cells at the back of the eyes, which are called the retinal ganglion cells, and are characterized by rapid loss of sight, which usually starts in one eye and then involves both eyes. So there was a study called the RODOS, or Rescue of Hereditary Optic Disease Outpatient Study, which recruited 85 patients in medical centers in the UK, Canada, and Germany. And by the end of the study, at 24 weeks, patients treated were able to read more letters on the chart compared with patients receiving the placebo. Furthermore, some patients who were unable to read any letters on the chart at the beginning of the study were able to read at least one line during the eye test after treatment. And this was considered to be clinically important. Additionally, patients reported improved color contrast sensitivity as well. So 30% of patients treated had clinically recovered vision, at least in one eye, compared with 10% of patients who belonged to the placebo group. Evidence also suggests that patients should be offered treatment early, soon after the diagnosis is made, in order to salvage the residual visual acuity, thereby providing the best therapeutic option. In Australia, it has been approved for use, but it's not subsidized under the pharmaceutical benefit scheme, so patients have to purchase it on their own. So there are some other uses. It has been attempted in clinical trials in Friedreich's ataxia, which is a rare genetic disorder that causes progressive nervous system damage. And most problems usually occur in childhood and leads to impaired muscle coordination, what we call ataxia, that worsens over time. It has also been trialed in patients with MELAS, and that trial has completed, but the results have not been published. Moving on to the next candidate drug, so a coenzyme Q analog called EPI-743, or also known as vincerenone. This particular drug is claimed to have 1,000 to 10,000-fold greater potency than both CoQ10 and idebenone. A 2012 phase 2 trial in children with Leigh syndrome, so 10 children were studied, demonstrated statistically significant objective neurological improvement with no significant drug-related adverse events. It has subsequently been used in 2 other clinical trials in children with Leigh syndrome. The results of those studies were reported at the United Mitochondrial Disease Foundation annual meeting in Washington in 2016. However, the outcomes have not been published to date. There are currently 2 clinical trials that are being conducted, and one of which is focused on investigating the safety and efficacy of EPI-743 in 94 children with terminal genetically confirmed mitochondrial respiratory chain diseases, which are considered who are considered within 90 days of end of life care. EPI-743 was actually developed by Edison Pharmaceuticals, and it was purchased, or the assets were acquired by PTC Therapeutics. So the same candidate drug is now called PTC-743, and it inhibits action on this particular enzyme called 15-lipoxygenase. This enzyme is a key regulator of oxidative stress and underpins the neurological disease pathology in Leigh syndrome. So there's currently a clinical trial that is being conducted to evaluate its efficacy for treating patients with mitochondrial disease with refractory epilepsy. And they're looking at potential sites in Sydney as well. Now, the next candidate drug is called elamipretide, and this has been developed with Stealth Biotherapeutics. The action of this drug is to stabilize the cardiolipin, which is the component within the inner mitochondrial membrane, and it acts by trying to reduce the production of ROS. A phase 1 or 2 trial for the treatment of mitochondrial myopathy in 36 patients called the MMPower study demonstrated safety and efficacy with improvement in endurance, which was demonstrated through a 6-minute walk test. However, a follow-up phase 3 study did not meet its primary endpoint, leaving the efficacy of the drug unclear. It has also recently completed a phase 2 trial in 12 patients with Barth syndrome called the TEST-Power study. The trial failed to meet its primary endpoint, at 12 weeks of study. However, there were statistically significant improvements at 36 weeks. So Barth syndrome is again a rare condition that is characterized by enlarged or weakened heart, what we call dilated cardiomyopathy, weaknesses of the muscle or skeletal myopathy, and reduction in white cell counts causing recurrent infections. Patients can also have short stature. Now, the next class of category of drugs are those that act on mitochondrial biogenesis, and this refers to an increase in mitochondrial mass. One example is bezafibrate. So bezafibrate was originally licensed in 1978 to treat hyperlipidemia, and it's an example of repurposification of drugs. So an observational study conducted in 6 patients with mitochondrial myopathy with the MELAS mutation, so M3243A to G, showed an improvement in the cardiac function as well as the muscle fibers, COX-deficient muscle fibers. However, there were concerns about the long-term treatment effects as it altered the fatty acid and amino acid metabolism and increased serum biomarkers. So the safety profile of this drug was questioned. Now, the next drug is resveratrol, which is found, it's a naturally occurring substance in red grapes, in the skin of red grapes, peanuts, and berries. A trial in patients with mitochondrial myopathies and skeletal muscle fatty acid oxidation defects has been completed recently, but the results have not been reported yet. Now, enzyme replacement therapy is an interesting therapeutic option, and has been used in MENGI, which is short for mitochondrial neurogastrointestinal encephalopathy. This is a rare multisystem mitochondrial disease that is caused by genetic deficiency of a specific enzyme called thymidine phosphorylase. And as a result of this enzymatic deficiency, there's a buildup of toxic byproduct called thymidine. It primarily affects the digestive and nervous systems, and it's characterized by severe gut dysmotility, pronounced weight and muscle loss, as well as neurological symptoms, including ptosis, which is drooping of the eyelids, and peripheral neuropathy. Patients may be misdiagnosed for years, as the disease can be mistaken for other illnesses, including anorexia, Crohn's disease, and irritable bowel syndrome. So enzyme replacement therapy has been attempted in the form of stem cell transplant and has been shown to be effective in restoring the enzyme activity and in reducing the toxic byproduct called thymidine levels to normal circulating levels. However, one of the complications of stem cell transplant in a study conducted on 24 patients was that it demonstrated poor survival outcomes, with deaths reported in more than 60% of patients. So obviously, it is clear that a safer treatment option is required for this particular disorder. And an alternative approach that has been investigated in the delivery of enzyme replacement had been developed by Entrada Therapeutics, and this is through a technique called erythrocyte encapsulation. In this strategy, the patient's red blood cells are removed from circulation and then treated with recombinant, so a lab-made enzyme, thymidine phosphorylase, and then it's loaded back into the cell through a specific device called a red cell loader, and which enables it to be encapsulated, so contained within the red blood cells. And then these red blood cells are infused back into the patient via a specific technology called EEV, which stands for endothymidine phosphorylase escape vehicle, which allows the delivery of the enzyme to the cells without being degraded inside the cells. So the preclinical data with mouse models of MENGI show that the treatment prevented the accumulation of toxic metabolites, and a phase 2 open label trial in adults has been planned but has not started recruitment yet. Now, moving on to what is more exciting in the forefront of mitochondrial disease is gene therapy. So gene therapy really involves the expression of a wild type or a normal healthy copy of a missing or mutated gene using viral vectors. It holds much promise based on clinical data, but with the exception of Leber's hereditary optic neuropathy, we are yet to see clinical translation in other mitochondrial disorders. And there are various viral vectors which have been used, example AAV or adenosine associated viral vectors to deliver this gene into the cell. Now, this is a clinical trial using Lumovoq, which is a gene therapy directed in Leber's hereditary neuropathy. So GenSight Biologics recently published in May 2021 results of this trial, where they use this specific recombinant gene therapy in a specific mutation for Leber's called M1178G to A. A total of 76 patients received a single intravitreal, so it goes into the eye, in one eye, and a sham injection or placebo injection in the fellow eye within 1 year of onset of visual loss. There are two studies conducted called Reverse and Rescue, and both eyes were considered as treated because the treatment efficacy was also observed in the contralateral or the other eye, which was not treated. So the trial found a statistically and clinically relevant difference in visual acuities in treated patients compared to 208 untreated natural history patients. So patients experienced progressive and sustained improvement from 12 to 52 months of treatment. So this is extremely promising and encouraging, and gene therapy may be the way forward, but there are lots of challenges with that as well. So just a second, last slide. So there are some points of attention regarding drug prescriptions as well as precautions that need to be considered in patients with mitochondrial disease. So this is more recently published in 2020. So there are really no, the only drug that has an absolute contraindication in patients with mitochondrial disease is valproic acid, which is an anti-epileptic agent, particularly in a specific genetic mutation called POL gene. It should be used only in exceptional circumstances, for example, if there are no other options for anticonvulsants, and particularly has to be cautiously used in patients with known liver disease in whom a genetic diagnosis of POL gene has not been established yet. Now, aminoglycosides, so gentamicin, etc., they are very broad spectrum and effective antibiotics that we commonly use in clinical practice. In the acute setting, it is a very effective antibiotic, hence the benefits of the drug in an emergency setting outweighs its risk. However, if it needs to be used on a longer term or chronic basis, then what is recommended is that patients be screened for specific mitochondrial DNA mutations because it can cause non-syndromic hearing loss. And then just to make a note as well, that a lot of patients with mitochondrial disorder have, various occasions needing the requirement for general anesthesia, for example, with gastrostomy insertions, etc. Relevant precautions need to be undertaken for such procedures because patients may have delayed recovery. There are specific anesthetic agents that we have to be cautious of, particularly neuromuscular blocking agents, etc. So we should have alerts in place so that the anesthetic doctors review them prior to surgeries.